Welcome back to Blocking the Flame, Anakinra and COVID. I'm your host Gaganasri, and in today's episode, we are diving into a topic that's as elusive as it's perplexing: long COVID, immunological hypothesis, and chronic inflammation. As we explore the lingering mysteries of why some patients experience persistent symptoms long after recovering from acute COVID-19, we'll attempt to untangle the complex web of immune responses that could be keeping their bodies in a perpetual state of alert. Joining me today is Aseema, a microbiology researcher who has a keen interest in the fascinating intersections between immune responses and chronic inflammation. Welcome to the show, Aseema.
Thank you so much for having me again, Gaganasri. I'm really excited to discuss long COVID as it's a topic with so many layers and there's still so much to uncover there.
Absolutely. The complexities of long COVID are like an intricate puzzle, aren't they? So
Yeah.
let's begin by laying the foundation. For our listeners who may not be familiar, could you explain what long COVID is and why it's become such a critical area of concern?
Yeah, of course. So, long COVID or post acute sequelae of SARS-CoV-2 infection, or PASC as it's referred, refers to a spectrum of symptoms that persist or emerge after the acute phase of COVID-19 has passed. And these symptoms can linger for weeks, months, or even longer, and they vary widely. Fatigue, brain fog, muscle pain, shortness of breath, and sleep disturbances are among the most common symptoms. And what's particularly worrying is that these lingering effects are not limited to those with severe COVID 19 cases. Even people with mild or moderate initial symptoms can end up with long lasting debilitating effects. And it's not just a matter of residual effects from the infection, but a persistent inflammatory response that does not seem to turn off once the virus is cleared.
It's like the body's alarm system is stuck in overdrive, even after the danger has passed. Now,
Yeah.
Asima, we know the immune system plays a central role in both acute COVID-19 and long COVID. What are some of the immune mechanisms that could be at play in long COVID?
Right. So, after the acute infection, the immune system typically works to clear the virus and restore balance in our body. However, in long COVID, the immune response does not fully resolve. Instead, it can remain dysregulated, leading to persistent inflammation. And there are a few key hypotheses about why this happens. One is that the immune system stays in a hyperactive state, continuously releasing pro inflammatory cytokines like IL-6 and TNF-alpha, even after the virus is no longer present. And this sustained inflammatory response can wreak havoc on the body, contributing to chronic symptoms that we see in case of long COVID. Another theory is that the immune system may begin to target the body's own tissues in what's known as an autoimmune response, resulting in inflammation and even potential damage to organs. This could explain some of the organ specific symptoms in case of long COVID, such as lung damage, heart issues, and even neurological symptoms. Additionally, there's a possibility that the remnants of the virus, such as viral fragments, linger in the body, continuing to activate the immune system and maintain a state of chronic inflammation.
Like I said, it's almost as if body's response is stuck in a loop,
Yep.
failing to hit the reset button.
Mhm.
So, Asima, what role do chronic inflammation and dysregulation play in the symptoms of long COVID?
Well, chronic inflammation is a central driver in long COVID cases. When the inflammation does not resolve, it starts to damage tissues and disrupt the normal functions of the body. For example, if inflammation persists in the lungs, it can cause difficulty in breathing and even long term lung damage. Similarly, if the brain is inflamed, it can contribute to symptoms like brain fog, difficulty concentrating, and even memory problems. The immune system's failure to shut down its inflammatory response leads to a state of constant immune activation, which results in fatigue, muscle pain, and other debilitating symptoms. So essentially, the body remains in an immune firefight, we can say, even though the infection has long since passed.
It's like the body's immune defenses keep on fighting a war that's already over, leaving lasting scars.
Yeah.
Now, how do immune mechanisms in long COVID compare to the other chronic inflammatory diseases like autoimmune disorders differ?
Well, that's a great question. So, long COVID does share similarities with autoimmune diseases like rheumatoid arthritis or lupus, where there's prolonged activation of the immune system and chronic inflammation as well. However, the key difference is that long COVID is triggered by a viral infection, where autoimmune diseases involve the immune system attacking the body's own tissues without a specific pathogen involved. And in long COVID, the virus acts as the initial trigger, but the immune system's response becomes dysregulated long after the virus has been cleared, which makes it quite unique. And this viral origin means that long COVID has some nuances that differ from typical autoimmune diseases, and it may require a different treatment approach.
So, while there's overlap, the root cause of the immune dysfunction in long COVID is viral, which could lead to different therapeutic strategies. Speaking of which, how might immune modulation help with treating long COVID?
Immune modulation is definitely a promising approach for managing long COVID. By targeting the ongoing inflammation, we can potentially calm the immune system without suppressing it entirely. For instance, medications like Anakinra, which targets IL-1, could help reduce the inflammatory response at the heart of many long COVID symptoms. But there's still a lot we don't know about how best to treat long COVID, as it's a new and evolving area of research at the moment. And beyond IL-1 inhibitors, other biologics targeting different cytokines like IL-6 or TNF-alpha could also play a role in managing the chronic inflammation that defines the long COVID.
So, while treatments like Anakinra may offer some hope, it seems we are still in the early stages of understanding how best to manage this condition.
Mhm.
As we wrap up, Aseema, do you think we are on the right in terms of research, or are there still major gaps that need to be filled?
Well, we are definitely making progress, but long COVID is still very much an emerging field of research. We need more clinical trials and long term studies to fully understand the immune mechanisms at play here and to identify the most effective treatments. Researchers are working on pinpointing the exact causes of chronic inflammation in case of long COVID, whether it's persistent viral fragments, immune dysregulation, or something else, entirely. While there's still a long road ahead of us, the growing body of research gives us hope that we will be able to offer more targeted therapies in the near future.
Thank you again for your insights today, Aseema. Your expertise in microbiology and immune responses has really helped shed light on the immunological aspects of long COVID, especially. It's clear that while we have come a long way, but there's still much more to uncover. Next time, we'll be exploring the research on Anakinra and long COVID, what's being studied, what signals are emerging, and where the gaps still remain. As always, this podcast is for educational purposes only, and for any health concerns, please consult your healthcare provider. You have been listening to Breaking the Flame, Anakinra, and COVID. Stay tuned for our next episode, where we'll continue to explore cutting edge research on COVID 19 and its long term effects.